If you have diabetes and want to know what diabetic retinopathy symptoms look like and when to act, here is a clear answer. I'm Mr. Dilraj Sahota, consultant ophthalmologist and medical retina specialist. I will cover what diabetic retinopathy does to your vision, which symptoms that you need to watch out for, and what we can do about it if you do develop these problems. Diabetic retinopathy is damage to the blood vessels at the back of the eye due to elevated levels of sugar inside the bloodstream. The most important thing to understand is that in the early stages, there can be no symptoms whatsoever. That damage may already be occurring and your vision may, to you, seem very normal. That's why the diabetic screening program exists in the UK. The photos that are taken will detect changes before you even notice yourself. When symptoms do occur, they typically include blurred or fluctuating vision, problems with reading, dark black spots in your vision, or shadows in your eyesight. If you have any of these, then these suggest that the disease has progressed and it needs a prompt review. What the stages actually mean. Not all retinopathy is equivalent. The most common type, the one that most people with diabetes will be affected by, is background retinopathy. That's not sight-threatening and doesn't need any treatment. That can be continued to be screened in the community. You don't need to come into hospital for that. At this stage, there are early vessel changes, but no threat to vision. So the main thing for you to do is to make sure you control your blood pressure, your blood sugar, and your cholesterol if it's elevated too. Time is on your side when you have background retinopathy, and hopefully that protects your vision for years to come if you can keep it at that stage, but you need to continue attending screening regularly. The two stages that require prompt specialist review are proliferative diabetic retinopathy, which is when new blood vessels grow at the back of the eye and are liable to bleed and damage your vision, and diabetic macular edema, where fluid leaks into the center of the retina and directly affects your reading. These are the stages where symptoms appear, and depending on how severe it is, it can be quite bad and need quite urgent treatment. What modern treatment can actually do? Importantly, anti-VEGF injections, which are the gold standard for diabetic macular edema when it's clinically significant, are not a last resort. They are a frontline intervention when your vision drops to a certain level or when the fluid is at a significant point, and can realistically preserve and improve your vision for years to come. Many patients assume that treatment only halts it from getting worse, but in diabetic macular edema, that's not the case. One thing to understand clearly, improving your HbA1c, your long-term sugar control, and your blood pressure control can halt progression, but if you're already in the latter stages, that may not reverse damage that's already been done. Both the medical control and the eye treatment are necessary. Neither replaces the other. The one situation that requires urgent treatment, if you have sudden loss of vision or suddenly a shower of black blobs or red strings in your vision, that can be a severe bleed happening at the back of the eye called a vitreous haemorrhage. It needs to be seen urgently, also to rule out any retinal damage. Go to the eye casualty straight away. Do not wait for a GP appointment. Attend your diabetic screening appointments regularly. Early diabetic retinopathy has no symptoms, so it needs to be picked up by the screening program. Ask your care team for your HbA1c, your cholesterol, and your blood pressure figures and optimize them. Make sure that they're at a safe level because they directly affect how fast your retinopathy progresses and how severe it can get. If your screening detects diabetic macular edema or proliferative diabetic retinopathy, ask for an urgent referral to the ophthalmology clinic because you'll need treatment. If you develop sudden onset black dots in your vision or a shadow across your vision or a sudden loss of vision, then go to the eye casualty immediately for an urgent review. One thing worth knowing, if your vision is fluctuating throughout the day and your eyes feel sore and gritty, that may not be your diabetic retinopathy alone. It's more than likely a common treatable eyelid condition, and I cover that in the next video, so please watch.